In other news, the government is set to increase COVID-19 vaccination centers to over 600 active locations, even with fears of a delay in the supply of vaccines for the second phase. Ministry of Health Director General Dr. Patrick Amoth says it remains unclear when the country will receive the drugs after India halted export of the Oxford AstraZeneca vaccine to enable it deal with its own local demand. And as KTN senior reporter Rita Tinina now tells us, the government says it may have to change its strategy to ensure demand for the vaccine does not outstrip supply.
On the 22nd of this month, 19 days after 1.02 million doses of the Oxford AstraZeneca vaccine arrived in the country, 45,000 people had been vaccinated. 3 days later, on the 25th of March, the figure doubled to 90,000. Since last Friday, when President Uhuru Kenyatta, First Lady Margaret Kenyatta and other high-ranking officials were vaccinated, 40,000 people have received the jab, meaning that at least 10,000 people have been vaccinated daily in the last 4 days. In total, 130,575 people have been vaccinated, and the government now wants to increase the number of vaccination centers to reach even more people.
In the next 1 or 2 weeks, we would expand our capacity to 652 vaccination sites plus outreach services.
With more vaccination centers and the number of those being vaccinated increasing by the day, the government says the strategy may change with time.
We wanted to move a bit slowly so that we don't create so much demand, especially now India, our next consignment of the vaccine may delay, then that will also send a negative signal to the populace. So we want to move slowly. Our data capture system is correct, sure that when we move, we only move to places where the healthcare workers have been trained.
With a positivity rate of 19.1% in the last 24 hours, 1,530 people have tested positive for COVID-19, bringing the total number of confirmed cases to 132,646. 12 deaths have been recorded, rising the number of fatalities to 2,147. Rita Tinina, KTN News.
From health issues tonight, more allegations of a possible malpractices